Hello friends, welcome to Studental. I am Dr. Salman Ansari, your mentor for today's topic, local drug delivery in periodontics. As we all know that periodontitis is an inflammatory condition affecting the supporting structures of the teeth. Local factors such as plaque, calculus and subgingival microbial flora are responsible for progression of periodontitis. Non-surgical mechanical therapy has always been the first line of periodontal therapy. But this non-surgical therapy has got certain disadvantages. The disadvantages of non-surgical mechanical therapy are it is difficult to clean in the multi-rooted teeth, especially in the furcation areas. There are bacteria found in dentinal tubules and root concavities which are difficult to clean. Patient may encounter tooth sensitivity during non-surgical mechanical therapy and also due to the presence of organisms deeply penetrated into the gingival tissues. So, to overcome this, antimicrobials, both systemic and locally acting, were used as adjunct to mechanical therapy. But th- this antimicrobial therapy has also got certain disadvantages. The disadvantages of systemic antimicrobial therapy are adverse drug reactions, antimicrobial resistance development, limited use in medically compromised patients, drug interactions, inadequate concentration of the drug at the site of action, inability to be retained locally for a sufficient period of time, and common disadvantages like nausea, vomiting, and diarrhea. To overcome these disadvantages, Goodson in 1979 introduced the concept of local drug delivery (LDD). The advantages of local drug delivery over systemic route is first, it is it can be used as an adjunct to scaling and root planing. It provides high concentration of the drug at the target site. It causes the sustained release of the drug at the target site. It limits the drug to its target sites and safely used in medical and it can be safely used in medically compromised patients. The classification of this local drug delivery are according to Rams and Slots in 1966 based on the type of therapy they are classified as personally applied, that is the patient home self-care. It is classified as non-sustained subgingival drug delivery. It includes the home oral irrigations and sustained subgingival drug delivery. Second, professionally applied, that is, they are used in the dental offices. They are non-sustained subgingival drug delivery like professional pocket irrigations systems and sustained subgingival drug delivery which are controlled release devices. The other classification according to Greenstein and Donetti in 2000 is based on the duration of medicament release. It is classified as sustained release devices and controlled release devices. The third classification is based on degradability. They are classified as degradable devices and non-biodegradable devices. The local drug delivery system, they are available in number of forms like fibers, irrigating systems, strips, films, gel systems, and nano or micro drug delivery systems. Now we will see them one by one. First is the indications of local drug delivery. The indications are they can be used in combination with mechanical debridement or alone. They can be used in the treatment of localized periodontal pockets. They can be used in periodontal patients who are medically compromised where surgical therapy is contraindicated. They can be used in patients who are suffering from recurrent or refractory periodontitis, and in periodontal maintenance therapy in shallow and residual pockets after successful completion of phase 1 therapy. It has got some contraindications like multiple or generalized periodontal pockets in same quadrant, periodontal patients with known hypersensitivity to certain drugs used for periodontal therapy, in pregnant and lactating women, and patients susceptible to infective endocarditis to avoid the risk of bacteremia. Now we will see the commercially available products and the drugs that are used in local drug delivery in periodontitis. These 5 drugs have been used successfully. The first is the minocycline. It is available in the form of dentomycin gel, Arrestin, and Perioclin. The second important drug is tetracycline. It is available in the form of Acticite and Periodontal Plus AB fibers. Doxycycline, again it is the most useful drug. It comes in the form of Atrodox. Metronidazole, it comes in the name of Elizol. And chlorhexidine, it comes in the form of Periochip, Periocol CG, and Closide gel. First we will see minocycline. Minocycline is a semi-synthetic derivative of tetracycline and a very potent broad-spectrum antibiotic. Minocycline works by interfering with the protein synthesis in the bacterial cell wall. It is available in 2 forms, in the gel form and microspheres. The gel, they are marketed in 2 different names as dentomycin containing 2% minocycline and Perioclin containing 2.1% minocycline. The microspheres comes in the name of Arrestin that contains 2% minocycline. These are encapsulated into bioresorbable microspheres. These microspheres are 20 to 60 micrometers in diameter and the resorption time is around 21 days. This is Arrestin. This is dentomycin and this is Perioclin. All these 3 are available in the form of gel that is to be administered, locally administered in the periodontal pocket. The second important drug is tetracycline. The second important drug is tetracycline. The tetracycline are available in the form of fibers. The fibers are degradable and non-degradable. These fibers are packed in periodontal pocket, secured with a thin layer of cyanoacrylate adhesive and left in place for 7 to 12 days. Local concentration of drug in excess is of 1300 milligram per liter. The Acticite comes as a non-resorbable fibers and it contains 25% tetracycline hydrochloride. And Periodontal Plus AB fibers, they contains 2 milligram of tetracycline in 25 milligram of collagen and these are the resorbable fibers. This is Acticite. These fibers are placed in the periodontal pocket and a thin layer of cyanoacrylate gel is applied to place it in pocket. These are the Periodontal Plus AB fibers These are mixed in saline and are directly placed into the periodontal pocket. The third important drug is the doxycycline. It comes in two syringe mixing system for controlled release of 10% doxycycline hyclate. It is known as Atrodox by market name. Doxycycline is a broad spectrum antibiotic synthetically derived from oxytetracycline. The mode of action is it is bacteriostatic and it inhibits the bacterial protein synthesis due to disruption of transfer rRNA and messenger rRNA at ribosomal sites. It is effective in significantly reducing collagenase activity in the GCF and gingival inflammation. This is Atrodox. It comes in two syringe systems. The two syringes are joined and then mixed and then placed in the periodontal pocket. The advantage of this is it reaches at the depth of the pocket and then it hardens. The third important drug is metronidazole. Metronidazole. Metronidazole is available as Alizole dental gel. It comes as semi-solid mix. It comes as semi-solid suspension which contains 25% of metronidazole benzoate in a mixture of glycerine, monoolate and sesame oil. It is viscous in consistency in the periodontal pocket. It liquidizes in the body heat and hardens. And in contact with water, it forms crystals. And from these crystals, the metronidazole is then released over a period of time. The most important of all these drugs is chlorhexidine. Chlorhexidine gluconate is an antimicrobial agent active against a wide spectrum of gram-positive and gram-negative organisms, yeast, fungi, facultative anaerobes, and aerobes. Its antibacterial action is due to an increase of the cellular membrane permeability followed by the coagulation of intracellular cytoplasmic macromolecules. It is available in the form of degradable collagen chips. The collagen chips comes by the name Periochip and Periocol CG. This Periocol CG is an Indian made. It also comes in the form of gel as Closite gel. This is the Periochip. It is after non-surgical therapy or scaling and root planing. This Periochip, it is placed localized in the periodontal pocket. This Periochip is 4 by 5 millimeter and 0.35 millimeter in thickness. The collagen base is made up of biodegradable hydrolyzed gelatin matrix with 2.5 milligram chlorhexidine gluconate. Closite. Closite is available in the form of gel and it is directly placed into the periodontal pocket. Now we will see the advantages of this local drug delivery over the systemic therapy. Local drug delivery attains a 100-fold higher concentration of antimicrobial agents in subgingival sites. It reduces the patient's dose by over 400 folds, thereby reducing the chance of drug resistance and side effects caused by these systemic antibiotics. Small doses can be administered at the localized site by LDD. It maintains contact with the pathogens in the infected site directly. We can employ broad spectrum antiseptics like chlorhexidine which cannot be given systemically. Superinfection and drug resistance are rare in case of local drug delivery. There are certain disadvantages also. The disadvantages are patients may not comply to the placement of drug subgingivally as it may cause pain. It does not have any effect on the adjacent or nearby structures such as tonsils, buccal mucosa, so may cause chances of reinfection. The process is time consuming, it is costly, and it is and in case of generalized periodontal pockets, we cannot use this local drug delivery. Also, difficulty in placing at the base in the deeper pockets and furcation areas. So, concluding this topic, local antimicrobial therapy is an adjunct to scaling and root planing and never a replacement therapy. All antimicrobial therapy should be preceded by thorough non-surgical mechanical therapy. As mentioned earlier also, local drug therapy is a value adjunct to mechanical therapy for desired outputs. Thank you.